When the party leadership reached a compromise with some of the more conservative members of their party, the Blue Dog Democrats. It includes scaled-back versions of some of President Obama's top priorities, including a government-run insurance plan to compete with the private companies and a requirement that employers offer coverage to their workers. Most small businesses, though, would be exempt from that. So, will that compromise be enough to win over any House Republicans? Congressman Mike Pence of Indiana is the chairman of the House Republican Conference, which makes him the #3 ranking Republican. He joins us now from Capitol Hill. Congressman Pence, welcome to Bloomberg News.
Thank you, Mark. Good to be back.
Congressman, is that compromise enough to get your vote?
Well, I don't believe it's enough to get the support of the American people. If the polls are to be believed, the majority of Americans are very troubled at the launch and the insistence by Democrats in this administration of the launch of a government-run health insurance plan. We believe it would lead to a government takeover of health care, and of course it would be paid for by some $800 billion in higher taxes.
Right.
We believe that that a government-run insurance program, a government option as it's referred to, will result in tens of millions of Americans losing the health insurance they currently have with their employer.
Congressman, as you know, the president and White House officials have been saying that the Republican line is a little bit misleading, that they're not talking about a takeover where they take away a citizen's right to choose their own doctor or to get the health insurance that they want. They're saying that what they want is to ensure that all Americans have access to health care, and maybe that might include co-ops. It might include also nonprofits. Is there any way that there can be some sort of compromise room between the House Republicans and the Democrats to get this done?
Well, I think most Americans, and certainly House Republicans and a handful of Democrats, recognize that if the government gets in the insurance business, whether it's an intended consequence or an unintended consequence, you're going to see millions of employers simply cancel the insurance that they offer their employees. I mean, there's independent studies that confirm that, but Mark, you know, common sense suggests during the worst recession in 25 years, when most businesses back in Indiana are struggling to keep the lights on and the doors open, that the minute that the federal government offers a government-run insurance plan like the House bill contemplates, or a government-subsidized co-op plan like is being discussed by Senate Democrats, that many businesses will simply sit their employees down and say, look, we love you, we appreciate your work here, but to keep this business viable, we're no longer going to offer health insurance as a part of your compensation, and send them down the street to Uncle Sam. As I said, I don't think that is necessarily the intention of every Democrat in Congress, or maybe of the president, but I believe it will be the natural result. People being relegated into a government system, a bureaucratic system that will ultimately result in rationing, and I think the kind of health care that very few Americans would accept.
Yeah, Congressman, what's Mike Pence's plan?
Well, I really believe that we do need to bring competition into the system, and we can do that by literally allowing the American people to organize themselves in insurance groups the size and dimensions that federal employees and members of Congress are organized. Right now, members of Congress and all 10 million federal employees are able to buy into private insurance plans on a nationwide basis. It's the Federal Employee Health Benefit Plan that's excluded from state-by-state regulations. If we passed our legislation for association health plans, workers at restaurants, workers in various aspects of this economy could organize not just on a statewide basis, but they could be exempt from those regulations and organize on a national basis, bringing down the cost of health insurance for small businesses. That, with a few other innovations that Republicans have been proposing, we think you can lower the cost of health care in this country and health insurance by bringing real competition and real reform to our private health insurance system.
Congressman, earlier today, my colleagues Patricia Wu and Peter Cook, we spoke to Jim Clyburn, the House whip for the Democrats, and he was convinced that they can find the way to get this through the House, that this will not explode the deficit. Are you concerned about that? Does the price tag, even with the cuts that some of the Democrats are saying they'll be able to make, does the price tag still give you cause for concern?
Well, look, you know, we're running a $2 trillion deficit right now. We just passed a national energy tax in the cap and trade, and now there's talk of a more than $1 trillion in spending. There's a $100 billion trim in there. But, you know, one of the unbroken truths of entitlement history in this country is that projections about costs of entitlements are always wrong and they're always low. The reality is the best way to control costs in health care and control government spending and the burden we place on future generations of Americans is not to launch a government program, a government-run insurance plan, but rather strengthen the private marketplace itself through the reforms that many Americans are prepared to support.
And Congressman, in about 15 seconds, is this going to get done this year?
Well, if getting it done means launching a government-run plan, a massive new bureaucracy with $800 billion in new taxes, I sure hope not. And we're optimistic that now the Democrats will report their plan out of committee. We're all going to go home for 5 weeks. The American people are going to have their say. Our hope is we can come back, work in a bipartisan way to strengthen our private marketplace without a government-run option injected in the middle of it.
Indiana Republican Congressman Mike Pence joining us from Capitol Hill. Congressman, thanks.